I'm Dipesh Mistry, and I'm a consultant psychiatrist and sleep physician. In a previous talk, I spoke about some of the reasons why melatonin is a popular choice for people who are trying to get on top of their insomnia. There are some people who should avoid taking melatonin, and in this talk, I'm going to cover some of the reasons for this. Insomnia tends to be more common in women compared to men, and so I think it's important to flag that melatonin is not usually recommended during pregnancy. Even though melatonin is naturally produced by our brains, and breast milk naturally contains melatonin, very little is known about the effects of taking melatonin supplements on an unborn baby. To put this another way, at the moment, there is not enough research to confirm that taking melatonin supplements while pregnant is safe. This is why doctors recommend that women who are planning on starting a family avoid taking melatonin. Melatonin is processed or metabolized in the liver, and it's cleared from the body by the kidneys. Because of this, it's recommended to be cautious about taking melatonin if you have impaired liver functioning or if your kidneys are not working as they should and you are on dialysis. Some people experience difficulties with sleep because of a condition known as nightmare disorder. Nightmare disorder is extremely distressing and is often experienced by people with post-traumatic stress disorder. This is a mental health condition which is commonly known as PTSD. Nightmares can also occur in people who don't have PTSD. We tend to dream during a stage of sleep known as REM sleep. REM stands for rapid eye movements. Some studies have shown that melatonin supplementation can increase the amount of rapid eye movement sleep that the person is getting. By increasing the amount of time a person spends in REM sleep, which is a stage of sleep where vivid dreaming is most likely to occur, this increases the probability of a person experiencing a nightmare. It is therefore advisable to be cautious about taking melatonin if you suffer from nightmares. I remember a patient who was quite nervous about taking any medications or supplements, including melatonin, and she asked me if melatonin was toxic. I thought this was a very interesting question and worth covering. In the field of toxicology, there is something known as the LD50, and this stands for the median lethal dose. In plain English, this is the dose of a substance that is required to kill half of the people who take it. Researchers have not been able to find the LD50 of melatonin in animal test subjects. Melatonin was found to not be fatal even when taken at doses which were as high as 800 milligrams per kilogram of body weight. So we can take this information to mean that in terms of toxicity, melatonin is safe.